Thank you for choosing the Weekend Vasectomy Clinic. We know there are a lot of options when choosing a vasectomy provider, and we're glad you've chosen us. We started the Weekend Vasectomy Clinic with the idea that we could do things differently and take better care of our patients. The Weekend Vasectomy Clinic was founded on two principles. First, provide a cost-effective birth control alternative that takes advantage of the most innovative medical procedures that make a vasectomy more comfortable and less invasive for the patient. And second, provide a much-needed procedure when it's convenient for the patient. Patients routinely modify their work and personal schedules to accommodate a procedure around a doctor's schedule. At the Weekend Vasectomy Clinic, we provide a procedure that works with your schedule while minimizing the impact on your daily life. Our providers were trained by the top experts in no needle, no scalpel techniques. Since then, they've performed the procedure hundreds of times. This video will help you understand the benefits of vasectomy as a form of birth control, the particulars of the vasectomy procedure, and any potential complications. If at any time you have questions or concerns, please bring them to the attention of your doctor, nurse, or any other associate of the Weekend Vasectomy Clinic. The no needle, no scalpel technique has proven to be every bit as effective as the traditional technique, yet far less invasive, which means that it's a lot less painful, has fewer risks of potential complications, and makes for a significantly quicker recovery time. It's important to us that you have a great experience. If at any time we're falling short of great customer service, please don't hesitate to let us know. Vasectomy is the most effective form of long-term birth control in which men can participate. It's minimally invasive, requires no general anesthesia, and has a very short recovery time. It doesn't hurt that a vasectomy is also far less expensive than tubal ligation or other procedures for permanent birth control. Next, let's see how the no needle, no scalpel vasectomy procedure works. To do so, you'll first need to understand a couple of specifics of the male reproductive system. The vas is a tube that carries sperm from the testicles to the ducts from which it's ejaculated. The vas is not involved in testosterone production, nor is it the source of masculinity. It's not involved with prostate health, erectile function, or sexual performance. Also, the vas is not necessary for normal testicular function. The vasectomy simply stops the flow of sperm through the vas. The first step in the vasectomy procedure is to numb the skin with a no-needle technique using a jet injector. The jet injector uses a simple puff of air to deliver the numbing medicine through the skin to the vas. After the skin on the scrotum and vas have been completely numbed, a very small opening is made in the scrotum to permit access to the vas. The opening is so small that it does not require stitches to close. Once the vas is exposed, we use a 4-step process to prohibit the flow of sperm through the vas. First, we clip both ends of the vas. Open-ended vasectomy options are available. If that's of interest, please discuss this with your provider. Next, we remove a small segment of the vas. Next, we cauterize the ends of the cut vas. We then isolate the two ends from each other. Finally, a small dressing is placed on the skin. The entire procedure takes 10 to 15 minutes for most cases. We minimize discomfort with the no needle, no scalpel technique. You shouldn't feel much more than just the plucking of a hair. Around 3% of men will have some bleeding after a vasectomy. You can help us avoid this complication by not taking aspirin or ibuprofen for about a week before the procedure and a few days after. Reducing your physical activity for the first several days after a vasectomy is also helpful. Any man who has a vasectomy is at risk for development of testicular pain. It's our experience, however, that this is a rare complication. It can typically be fixed with further surgical intervention in the rare instance that it's needed. After a vasectomy, sperm may leak from the end of the vas that's still connected to the testicle. If this takes place, your body will wall this off in what is called a granuloma. It's not harmful to you, nor does it impact your ability to heal from the vasectomy or the overall effectiveness of the procedure. This will resolve with time, but the use of ibuprofen and ice will clear this up. Some key points to remember. Vasectomy is intended to be a permanent form of contraception. Vasectomy does not produce immediate sterility. Following vasectomy, another form of contraception is required until vas occlusion is confirmed by post-vasectomy semen analysis. This will typically require 20 to 30 ejaculations. We will send reminders about 6 weeks after the vasectomy and every 6 weeks after that until we see a negative specimen. You're not sterile until we confirm no sperm on a specimen. Even after vas occlusion is confirmed, vasectomy is not 100% reliable in preventing pregnancy. The risk of pregnancy after a vasectomy is approximately 1 in 2,000 for men who have post-vasectomy azoospermia or PVSA showing rare non-motile sperm. Repeat vasectomy is necessary in less than 1% of vasectomies, provided that a technique for vas occlusion known to have a low occlusive failure rate has been used. At the Weekend Vasectomy Clinic, we always use proven low failure rate techniques. Patients should refrain from ejaculation for approximately 1 week after vasectomy. Options for fertility after vasectomy include vasectomy reversal and sperm retrieval with fertilization. These options are not always successful, and they may be expensive. Please speak with your doctor if at any time you have questions regarding a vasectomy reversal. The rates of surgical complications such as symptomatic hematoma and infection are about 1 to 3%. These rates vary with the surgeon's experience and the criteria used to diagnose these conditions. Chronic scrotal pain associated with negative impact on quality of life occurs after vasectomy in about 1 to 2% of men. Few of these men require additional surgery. Other permanent and non-permanent alternatives to vasectomy are available. Again, we thank you for choosing us. We will work our hardest to ensure that you have the best vasectomy experience possible. Your provider will ask you if you have any questions about this video. All of our providers are experts in the field and can answer any additional questions this video did not adequately address for you.